Hello, friends. So, here today to talk about sex education and very small children. Very small, 2, 3, 4 years old. Very small children. And you're probably thinking, that's crazy. Well, it's not. And here's why. Parents are asking. I just got this question last night. Parents are asking, how do I start to have these conversations with my very small child, 3, 4 years old? It's really not as big a deal as everybody thinks it is because we as adults have been trained to feel certain ways about sexual conversations. We think that that's the only way for them to feel, and that's just not true. So, first off, is you can absolutely have these conversations. The key with these types of conversations, any conversation, okay, even if we're talking physics, you can teach physics to a 3 year old. You really can. The trick is you have to use what we call developmentally appropriate language. Okay, developmentally appropriate teaching, learning language. So, what does this mean? Well, developmentally appropriate means a few different things. Okay, we're talking about development of cognition. Okay, so can your child cognitively, thought, brain related concepts, can they understand the words that you're saying? Okay, so you need to choose words that they already know, that they already understand. Okay, so we're not going to talk about intercourse with a 3 year old. That's not going to happen. Okay, they don't understand that word. They don't know what that word means, and there's no reason to teach them that word because they don't need to know that. All right, so another concept is social development. Okay, are they socially able to understand other people and understand themselves and understand how you behave in a particular situation? Okay, this is community, this is friends, this is family. Okay, your social world. Do I understand what that's supposed to look like? All right. There's a few others, but those are the main two in terms of sex ed for very small children. So, how do we start having these conversations? How do we start working with our children about what it means to be in intimate relationships? All right, so we don't use any of those words. We don't talk about relationships. We don't talk about intimacy. We don't talk about sex. Okay? All of this starts way, way back with consent and respect. Okay? Those are the two first things any person, any human being, regardless of how old you are, needs to understand to have not only acceptable, but healthy and desirable and satisfying sexual relationships. Okay? Consent and respect. So, how do we do that with a 2, 3, 4, 5 year old? Well, 2, 3, 4, 5 year olds talk about holding hands, talk about sitting next to each other in the playground. They talk about, hitting, okay, hitting and kicking and those types of things. These are all physical contact, okay, all types of physical contact. We also talk about hugging. We hug small children. Small children hug other people, okay? Hugging is a completely acceptable version of sexual contact for a 2, 3, 4, 5 year old, okay? Because we don't think it's sexual. Well, it can be. So, there's this idea that has to be presented to small children that just because you want to hug someone doesn't mean they want to hug. And that can be because that person doesn't want to be hugged, or it could be because that person doesn't want to be hugged right now. Okay, so there's a concept of body autonomy, right? This person does not want to be touched. Okay, and then there's this concept of time frame, right? So is this an appropriate time? Is this an acceptable time to engage in some kind of physical touch? Yeah. So how do we do this? How do we actually functionally teach these things to small children? Well, guess what? Just like everything else, it starts at home. And it starts with the parents or guardians or whoever it is that's taking care of a small child. Okay? So it is incredibly common for parents or whomever to hug their small children. Okay? This is not strange, this is not weird. Many, many people hug the small children that they care for. Okay? They also invite those children to sit on their lap, or the child asks to sit on the lap. Okay, so lap sitting is also an incredibly common thing for small children, right? These are, quote, normal behaviors that everybody doesn't worry about. They think they're fine. It's not a big deal. So use those. Use those things that are developmentally appropriate to engage in conversation about things that you want your child to understand. All right, so very, very first thing that you can do once your child is able to kind of speak or be able to respond, whether that's through sign or verbal speech or whatever that looks like. Okay, whenever you're able to communicate with your child and you understand them and they basically understand you, okay, you can start to say, "Can I give you a hug? Would you come sit on my lap? Would you like a hug? Would you like to come sit by me?" Okay? These types of questions are totally chill for a 2, 3, 4, 5-year-old. They don't think that's weird. They don't think it's strange, right? Adults think it's weird. They shouldn't, but they do. And so you start by doing what we call, and will totally make sense to you, modeling this behavior. Okay? Up until about age 7, it varies per child, but up until about age 7, children learn by modeling, by matching physical movement. Okay? This is what we're talking about. And so when you teach your child to eat with a spoon, you hold the spoon. You put the spoon towards your face. Okay? You show them what to do. And then you take their hand and you put it on the spoon. And you move the spoon towards their face. Yes? These are very normal things that all families do when teaching children how to do a thing. Okay? You show and then you help them physically make that movement. Right? No reason we can't do this with sexual education. No reason. Zero reason at all. All right? So you model the behavior of asking for a hug, asking for physical contact, sitting in laps, holding hands, whatever. Okay? However that happens in your family. Okay? So if you generally have a bedtime routine that involves, okay, now we give each other hugs and we go to bed. You generally have a come home from work routine that is everybody gives you a hug when you get home from work. Whatever that generally looks like in your family, just use that. You don't have to go over and above. You don't have to do anything extra. You don't have to do anything extra. Isn't that great? You just incorporate this tiny little piece, okay? Asking the question, all right? You do it, okay? And then if your small child has siblings, or if they're out playing with friends, okay, or if you're visiting other people, when your child goes to touch someone, to hold their hand, to get a hug, to whatever, you stop them, physically stop them, and say, we must ask first, or we need to ask first, or we have to ask first, or whatever phrase, okay, it doesn't matter what words you use, that says we have to ask first before we can do these things. Okay? And so you teach them to ask, can I give you a hug? They don't think it's weird. They don't think it's weird. Because if you don't treat it weird, they don't understand that it could be weird. They just think it's normal. Yeah? So, the next piece comes when trying to deal with the response to the question. Okay? First, we got to learn to ask the question, then we got to figure out how to deal with the response. So, with very small children, okay, some of them don't really like to be touched, and you have to kind of force them into hugs and force them into holding hands and on. So, stop it. If you ask a child, can I give you a hug, and they say no, then don't touch them. Okay? Because if you ask the question or if you don't ask the question, and either way you ignore what that child is saying to you, you're teaching them that they're allowed to ignore other people. Ignoring is an allowed option for responses to questions and concerns and so on. Pretty sure nobody wants to teach their child to ignore when someone tells them no. That's probably not anything people set out to do when they're raising their children. I mean, maybe, but I doubt it. So, don't ignore your children. Okay, I have a not quite 2-year-old at home, and we work on, can I give you a hug? Can I have a kiss, please? And we do kisses on the cheek, and can I have a kiss, please? And sometimes she says no. And as much as I don't like it, and it kind of hurts my feelings, I have to say, okay, thanks. We'll do, move on. Talk about something else. All right, let's read a book now. Whatever, doesn't matter. Okay? Yeah, sometimes it hurts my feelings. I'm a big, strong adult, and it still hurts my feelings when my kid doesn't want to be physically affectionate with me. Sorry, too bad. She gets to choose how she uses her body. Plain and simple. Okay? So, you're modeling again. If they say no, you say, okay, and move on to something else. Don't get sad. Don't extort them. Don't tell them they need to, give you a hug or beg for them. Okay? Just move on. They'll probably hug you in 30 minutes or the next day or whatever. All right? So then, every once in a while, not every time, okay, because you want it to just be normalized behavior, but every once in a while you can say, after they say no, you say, okay, you said no, so we're going to do something else now. Okay, so you highlight for them what it is that is happening, okay? So most of the time it's just the thing that happens next. We just move on, okay? That's modeling, right? So then there's specific teaching, direct teaching, which is telling them what is happening, okay, using words rather than modeling. And that is, you said no, so I'm not going to hug you. We're going to go do something else now. Okay? It's really, really not hard, guys. It's really not hard. This is what we do. We model what we want to see. Okay? There's that really great poem that I've seen in every doctor's office I can think of. Children live what they learn. Yeah. It's really that simple. So then you follow through when they visit their friends, they visit family, so on. The other person might say no. And if you're working with grandparents or aunts and uncles or so on, you can encourage them to every once in a while say no, just so that your child gets the practice. And then you talk to your child and you say, oh, they said no, so we're not going to do a hug right now. And off you go. Go play with toys, go play outside, go whatever. Right? Just move on. It doesn't have to be a big dang deal. Okay? So are we seeing how this eventually turns into sex ed? Right. So we're talking about consent, and we're talking about teenagers and kids in college, and they're getting a no response from someone, and they're okay with that. Yeah, this is how this happens. Okay? We start when they're 2 years old. They get used to hearing no, and they recognize it ain't about them. Doesn't make you any less manly, doesn't make you any less desirable, doesn't make you any less anything, just because somebody else doesn't want to be touched right now. Had nothing to do with you. It's 100% the other person. Making sense? All right, so those are the super duper basics of teaching sex ed to very, very small children. Consent and respect. Consent and respect. Yeah? So consent is the ask and answer. Respect is the ask and follow through with the answer. Making sense? Making sense? All right, obviously, if you guys have any questions, you're welcome to leave them in the comments. You're welcome to give me a call at my office sometime. I'm happy to be a part of any sexual education you feel is necessary for your lives. If you need me, give me a call. I'll see you soon.